It's a beautiful day in the gayborhood, a beautiful day to ask a gay doc with Desert Oasis Healthcare's Dr. Renzo Corzano. Hey, Doc Renz, how are you?
I'm good. How are you?
I'm doing all right. You know, we were talking about last month was Mental Health Awareness Month, and it seems like more and more that's coming to the forefront in our LGBTQ plus community. We have a lot of folks that are battling a lot of demons, and you've done a deep dive into some of the stuff that we should be keeping in mind.
Yes, the LGBTQ people are more than twice as likely than heterosexuals to have a mental health disorder in their lifetimes. They're also 2.5 times more likely to experience depression, anxiety, and substance misuse. 67% of LGBTQ versus 39% of heterosexual people report needing mental health services over the past 2 years. But only about 50% of them actually sought any services, and 50% of them actually received any help. And then I was kind of reading about what like the possible unique challenges are in our community, and a couple things were listed. And one of them would be like stigma, discrimination, bias, violence. And the one that was kind of important to me was there's a lot of gaps in receiving adequate mental health care. Personally, for me, like just based on what I've seen in my patients and, in this population here, especially in the Valley, is how important it really is to identify like LGBTQ plus providers or friendly providers that are actually in mental health that can actually help our people. Oftentimes I've had, patients who just start crying in the office, right? About, their struggles and a lot of mental health issues that they're having. And the number one request I get is often when I suggest, behavioral health, what they ask me back is, oh, but are they gay or are they, gay friendly? Because there is that need for us to have someone who understands where we come from, right? Because I feel like a lot of the time there's a lot of PTSD in us just
Yeah,
based on
we have unique baggage, and
yes,
we carry around unique trauma. I mean,
yes,
everybody's is totally unique, but
yes,
for people that, I mean, for the older generation that lived through the AIDS
the AIDS
crisis,
epidemic,
yeah,
exactly,
and
definitely,
went to a funeral a week for a number of
yes,
years, and I mean that is, and we are all so strong and brave in this country, and nobody asks for help. Everything is bootstraps, and pull up your bootstraps. It's hard for people to ask for help, isn't it?
yes, very much so. And so, I mean, my plea basically is you got to talk to your provider. You have to be honest with your needs, and that's like the first step. But I also feel like it's a physician's responsibility to make that space as safe as possible for them to actually be able to confide in you and actually tell you what they need.
When you tell me your patients will, break down in tears in your office, and it's a testament to them feeling that it's a safe space to just drop the guard
I
and get
hope
real.
so.
Get
Yeah,
real.
yeah. So, and then something else in this deep dive that I was doing, I went into the Trevor Project website. So
Hmm.
73% of LGBTQ youth, they've experienced symptoms of anxiety, 58% symptoms of depression, 45% of them have seriously considered attempting suicide in the past year.
Mm.
They also have like very unique challenges, like bullying that goes on in schools and not having a supportive home to go to. They're physically threatened or harmed, or they're subjected to conversion therapy.
We think about our own trauma and baggage and don't realize that the younger generation has, the online bullying, cyberbullying, the anti-trans legislation that's
Yes,
being proposed all over the country.
all over the country.
And, we have the
Exactly.
Transgender Health and Wellness Center, and they have the Marsha P. Johnson Drop-In Center for LGBT youth in Palm Springs. It's really vital. And we also have, groups, in schools that are, gay straight alliances. So together with people that are sort of facing the same challenges really helps. I'm always the glass half full guy, with the rose colored glasses. Pollyanna, call me what you want. But Have you seen people really turn it around?
Yes. And you know what I love about that? Months later, maybe a year later, and you see them, and there's like this light to them. It's almost like the baggage has been lifted and they seem lighter and brighter. And I
Yeah.
love seeing that, actually. I really do, because it means that they're coping with it. And I think that's really beautiful, actually.
We do have help that people can access here locally. And now we welcome to our Ask a Gay Doc microphones the fabulous Dr. Jill Hingston, who is a psychologist and is the director of behavioral health services at the center, our LGBTQ plus community center of the desert at thecentercv.org. Welcome.
Hi, John.
Good to see you again, Jill. And
You too.
we've been talking about all of the startling statistics. And when should somebody be looking to get help?
Well, if you are a young person, I would say, if when you're struggling with either coming out or you don't have support, like basically when you figure out you're queer, reach out, because the world is hard and the rhetoric is, everybody's hearing it. The kids we see now are afraid. They're afraid Trump's going to get elected again and everybody's going to lose their rights. So it's really, really intense for a lot of people.
As an adult who's been self-sufficient and I've been able to handle everything on my own, when is it time to reach out?
I think whenever you're feeling the stress of it. I mean, I think on some level, we all want to deny and push aside. We don't want to really face uncomfortable feelings. We've actually been talking about starting some sort of support group around the upcoming election, and just, what can we do? Because the center, one of our things is we always say, we're here for you. Like we are the community. We are here to support you. Like, please come let us support you. We have tons of stuff to get involved in, and just creating that community with other people, that support right there. But if you're at home isolating, you're not going to get that.
And you do have support groups, and one of the things that people deal with at a certain age in this community is loss, and so you have bereavement groups, and that's really helpful for people to be together. And it does help to know that, oh, I thought I had it bad.
Yeah, I think the biggest thing, with our support groups is it's a way to connect with other people. It's a way to understand that we aren't the only person going through this, and to be able to share that, because sometimes just saying things out loud is healing in itself. And
Yes.
so, if, and I get it, people are reticent about joining groups, but I'm telling you, like, lifelong friends have been made through our groups because there's just such a deep connection.
And you do have
solidarity matters.
You do have therapists for one-on-one too.
Oh, yeah. Yeah. We see probably about 150 clients a week.
Wow.
For individual and or couple therapy. And right now, the staff is being trained in affirmative CBT, which has all to do with being a minority in this society. And this is through Yale University. And so all of the staff will be trained in this. And it is about connecting the stress of growing up queer to like responses, reactions that people have now, whether it's drugs and alcohol or, whatever it is, isolating, not doing things, fear of rejection. We've all experienced these things just from being queer.
And also, yeah, we were talking about substance abuse with Dr. Corzano. It's in a lot of cases self-medication.
Yes, absolutely. That's what we do. Yeah.
Oh man, I am so lucky I live in a town that has people like Dr. Jill Hingston and Dr. Renzo Corzano from Desert Oasis Healthcare. Ask a Gay Doc. We have an email address, and you'll have your HIPAA respected if you send your question to lgbtqhealth@mydohc.com. And we do respect your confidentiality. And of course, all of the professionals at the centercv.org that you can access with the help of Dr. Jill Hingston. You can heal. It gets better. Thank you, guys.
John, how'd you know I was gay?
Assumptions.
I've seen the arm candy that you go out with.
Oh, that, yes.
Oh my God, I love it. There can just be best friends.
Oh no.
No.
No,
I saw him sucking face. All right.
Prince do that too.
Yeah. Really? Okay, then. Thanks, guys. We really appreciate you in the
Awesome.
neighborhood. Thanks again.
Thanks.
Hey, nice to meet you, Jill.
Hey, you too. Great to meet you. Thanks, John.